guys, Dr. Andy here. Today I want to tell you a little bit about the cases that we've been seeing lately in the office. Some of our tennis players have been coming in with some knee issues. A lot of our players, they're kind of like worried, oh my God, is it like osteoarthritis? I've been killing my knee too much. The good news is for most of our players, the answer is no. The pain is definitely kind of like in the front of the knee, not very deep. That's the good news. And then kind of when we dive into it, we kind of find out that this patient is really kind of dealing with what we call patellar tendinitis. It's one of the most common injuries we see with our tennis players. So let me give you a little bit of a quick anatomy check here. The red, at this point, TheraBand is representing our quadriceps muscles. The quadriceps muscle, quad just means four. There's four beefy muscles that make up the quad. So really like a huge muscle here, okay? The problem is that those huge muscles, they transfer down into a smaller and smaller piece of tendon. Anytime you have that, where big, huge, beefy muscles move into small, tiny tendon, it means there's a lot of stress going into a small area. Let me show you what I mean by that. So big, beefy quad muscles, a tendon is what attaches muscle to bone, okay? And it needs to get all the way down here to what we call the tibial tuberosity. This is actually where the quad muscle is attaching below the knee, all right? So what happens is it goes muscle, muscle, muscle. Before it gets to the knee, it turns into this black tendon right here. This is the patellar tendon. It then goes through and around your patella. This cream right here, the beige tape, is representing your patella, and then continues below it to attach to the lower leg, okay? So kind of cool is that the patella itself is sitting inside the tendon. It's on the sides, the front and the back. It is sitting directly in the middle of it. So your patellar tendon is actually surrounding the entire thing, okay? So huge beefy quads, all of that power, all of that muscle contraction, you are running back and forth on the tennis court constantly. You're playing an hour, 2 hours. You're putting all of that tension over time into this tendon. And as a result, it wears down. In the end, unlike things like strain sprains, a tendinopathy, especially this type of an injury, like a quadricep issue, is an overuse injury, meaning it's not something you develop overnight. It's something that happens over a longer period of time, whether it's months, weeks, maybe years. But really what's happened is you're putting all of this pressure, all of this tension into this small tendon. It starts to wear down little by little, breaks down little by little. One of the problems is tendons and ligaments, they're not very vascularized compared to like a muscle tissue, which means that it heals slowly. So once the damage gets in there, if you don't let that heal, it will gradually wear down. So all of our treatment options are really designed around increasing blood flow to the area. That's where if it's like really painful, maybe some laser can help it early on. After that, you might do some needling to like increase some blood flow to the area. If you really kind of like want to take control and kind of like set off a nuke in there and really kind of get things going in the right direction, that's maybe where we would do shockwave therapy. Shockwave therapy would break down all of that damage, clear it out, and then stem cells would come into the area and repair all of that. So I think that would probably be the best way to go. At the same time, you do have to work on these muscles, get them to calm down, probably teach you some exercises for the hip, the knee, the ankle, maybe look at mobility in those joints as well, to make sure that, when you go back to playing tennis, hopefully as soon as you possibly can, we don't re-injure the area because we're now not causing as much as much strain into that tendon, okay? So hopefully that kind of tells you a little bit about patellar tendinitis. If you have any questions, let me know.